Next speaker is Dr. Thom Lobe. He is going to speak to us about surgery and research in adolescents, consent, assent, and legal emancipation. Thom, in addition to being a pediatric surgeon, has a JD degree, so he should bring some unique insights into this.
Thank you, Mac, and it's a pleasure to be here and see so many people at this late hour in the audience who are interested in what we have to say. I have nothing to disclose that's pertinent to this discussion. So adolescents, like some younger children, are perhaps a bit like this cartoon with respect to their parents and caretakers. You can make my body go to school, but my soul will be outside running through the sprinklers. I suppose some of us feel like that every day in our practices. And rather than talk about some of the problems with research, I think it's pertinent to understand some of the definitions that we live with regards to the various consents, assent, what constitutes emancipation, when can an adolescent behave like an adult, at least legally. And so the consent, as you know, is part of this informed process that provides sufficient information about the study procedure or procedure that's about to be performed so that the participant can make a reasonable decision. Now, this is really based on understanding the potential risks and any anticipated benefits. It doesn't waive any rights. And what's important about the informed consent, particularly with regards to children and adolescents, is that they have a capacity to make the decision. And at least legally, it's clear the law believes that being a minor is a disability in terms of the law, and because of that disability, someone else, some greater caretaker, parent, or guardian, really has the right to make that consent for you. Interestingly, there's this concept that's coming up now in the law is that the providers, us, as practitioners, have a legal and ethical duty to the patient to render competent medical care and base therapy based on the patient's needs. So this puts the practitioner oftentimes at odds with a parent or guardian with regard to a procedure of some medical necessity. Now, research is a little bit different, and perhaps the biggest area of controversy is in bariatric research, where you have a procedure that may be under a research protocol in a given institution. However, it has some medical benefit to the patient. And if we as practitioners believe that this procedure or some procedure to reduce weight has a lower risk than the disease, which is obesity or morbid obesity in the case of an individual adolescent, we have some duty to that patient at least to make sure that they get in some appropriate therapy that addresses the obesity, whether or not it's the study procedure. Assent is a little bit different, sometimes confused with consent, and it's an active affirmation of the desire to participate, and it differs from the consent, which is granted from an individual with a legal authority to do so. So consent has to be given by someone with a legal authority, usually a parent or guardian. The assent can be granted by a young child, and the request, therefore, must be appropriate to the age. We want them to agree. So the elements of an assent that are important is to help the patient understand in a developmentally appropriate way what their condition is. We need to tell the patient, the young patient or adolescent patient, what to expect. And we have a duty to interpret our assessment of the patient's understanding. So we have to give them the information, we have to understand, or at least have some level of comfort that they understand what we're saying. Again, this depends to a certain level on the maturity of the individual. We want to solicit the adolescent's willingness to accept the proposed treatment of care, and this is really what the consent's all about. A minor may dissent, so they may refuse the assent, and ethically this is binding, and particularly in research. So again, you have a bariatric procedure. We use that as an example where there's no clear benefit, and maybe there are other ways to lose weight, and the patient says, I don't want the operation, and the parents say, we want the child to have the operation. Well, in that case, the patient has not given their assent to the procedure, even though the parent has given their consent to the operation. And at least in the law, there is given considerable weight to the assent of this young patient or adolescent. And there is a tendency that the wishes of the child should prevail. So when it's not, the intervention is not essential to the welfare, and a deferral poses no substantial risk, especially when there are other therapeutic options, then even though the patient's parents or guardian give their consent to the procedure and agree with the physician, if the patient doesn't want it, if the adolescent doesn't want it, then the courts in many cases will defend that child in his right to have his dissent heard. Emancipation is something interesting. It really allows patients, teens, to consent to surgery. In most states, the laws differ. The age of majority in most cases is 18, under which you're a minor, and the states vary a little bit. There's one state where the age is 21. In Texas, if you can prove financial independence, the age is 16. It really varies and really depends to a large extent on the prerequisite of demonstrating financial self-sufficiency. You must say that you're self-supporting, you're not living at home. Interestingly, just because you are pregnant doesn't mean that you are emancipated in the eyes of the law. You may have some medical emancipation, but you're not emancipated legally. If you are in the military, you may have some court say that you're emancipated. A court may declare you emancipated if you have a compelling argument as an adolescent and tell them that you're self-sufficient financially and can prove that. There are some cases of mature minor, at least medically emancipated, in the sense of if you're seeking treatment for STD, pregnancy, drug, or alcohol abuse. The states vary a little bit, but in most instances, they will consider that you have the right to assume decisions for your health care as though you were emancipated, although for all other aspects of your legal interaction with the state and the community, you're not truly emancipated. Some examples requiring an informed consent: immunizations, invasive diagnostic procedures, long-term treatment procedures, clubfoot surgery, surgery for a suspicious mass. These require a parental consent. Where you need informed parental consent for adolescents, a pelvic examination, diagnosis for recurrent headaches, request for contraception, long-term antibiotics for acne, surgical intervention for a bone tumor or some other type of surgical procedure are all cases where in an adolescent it requires parental consent. There are many cases, where the parent and adolescent disagree, and this really is a medical perspective. For example, it really depends on the competence of the adolescent. They're encouraged to consult with their parents or guardians. The parent involvement should not pose a barrier to care if the child wants something and the parent doesn't. So in some cases, the states will offer mediation to help the minor really have his or her decision prevail. And this is, again, newer in the law, that the minor's decision should be binding in those cases. This brings up the interesting situation, and we'll sure you can go play Kevin's house if it's all right with your attorney. So sometimes it really puts the legal system can put the parent and the adolescent at odds. Parental informed consent with the patient assent, you can see the sorts of procedures where this is recommended. Certainly some surgical procedures this is appropriate for. Perhaps this sums things up, and I'm happy to answer questions. Again, individual states differ and situations differ, but certainly parental rights, they have a duty to protect young people, their children, and particularly when their children lack the adult cognitive capacity. On the other hand, the rights of minors, as Gretchen pointed out, particularly middle adolescents on, they have a desire to make their own decisions and establish independence. And at least in the eyes of the law in most states where they have the ability to make competent decisions, their decisions tend to prevail even over the parents. Thank you.
Thank you, Tom. Questions from the floor? Tom, so if you recommend an appendectomy for acute appendicitis in a 15-year-old, the parents say, yes, please go ahead, and the child screams, no, I don't want surgery.
Well, then, as a caretaker, you have to decide what the prevailing evidence is in the literature. And so if there's sufficient evidence to justify, and the teen can say, well, you know, my friend had antibiotics for his ruptured appendix, why can't you give me those? Will that be good enough? And if you believe as a practitioner that that's equivalent therapy and safe, and it doesn't put the patient at risk, then you say, you know what, it's a reasonable option. And if you don't do well with antibiotics, we're obviously going to have to operate. Is that okay with you? Yes, and you proceed in that way. However, if you think that the patient is putting himself at risk in harm's way, then you have a right, and then could go to the courts legally and say, you know, we have a situation here, I need your backup. Because otherwise the child could sue you. Interesting.
Thank you.